This is not a threat. It is a plan of action that seeks to protect your businesses and protect us as well, because there will be no exception. There is no VIP. You will not bribe or intimidate our law enforcement officers. You'll be caught and you'll be charged in court, no matter who one is, no matter the political position, no matter the financial ability. As the President said, the Ministry of Interior, the Ministry of Health, and coordination of national government will ensure that everybody and everyone abides by these laws. COVID-19 haitabui VIP, and neither then will we. My dear friends, today I would like to point out something that you should know, even if it belabors the point I have been making. There are now more than 4 million cases in the United States of America. It took 98 days to reach the first million people. 44 days to reach the second million people. 26 days to reach the third million people, and 15 days to reach the fourth million. And as you have seen for yourselves, when we started off, we were growing at a very slow rate. What we have seen now is that in 21 days, we have virtually doubled our figures as well. With freedom of movement and increased human contact, that is what happens. Indeed, ever since we lifted the cessation of movement, our own numbers have surged. While our death remains relatively low compared to many nations, we expect them to steadily climb as well. It is a fact that we must be prepared for. So, what am I saying then? I am saying that back to the responsibility issue, please, and I'm imploring you, if you do not need to travel, if you do not need to travel up country, don't. If you can avoid visitors at your home, avoid them. If you can avoid visiting people, avoid it. If you can avoid closing in on people and being too close to them, don't. Don't, because science doesn't lie, and either do figures. We can and we should learn from others where they have succeeded and where they have failed. By taking such steps, we will ease the burden on the government and also save our lives. I have seen people write articles. I saw another one in a foreign paper the other day, where one insinuates that by us telling people to take responsibility, then it means that the government is abandoning its people. I think that is a very foolish notion, because by the end of the day, it is not the government. It's not a government issue, and we have repeated it here many times. This is an individual responsibility. It is individuals who get sick, and it is individuals who die. So I beseech you that even as we report on these things, let us report from basic facts and not innuendo or rumors. As I always say, if you protect me, I can protect you. Save me, and I'll save you. As I give you today's figures, I would like to call upon our public officers, our Nyumba Kumi, and policemen to be vigilant in enforcing the directives given yesterday by the President. And as you heard, the Inspector General of Police will be submitting a weekly list of establishments closed. My prayer is that you save your establishment. If you have a bar, please don't spoil your business. Please avoid being closed. It is not business as usual. The enforcement agencies have been attacked so severely because of relaxing on this issue. And I want to make it clear, this is a public health issue. It is not an enforcement issue. So going forward, it is the public health officers who are going to go around and withdraw your license and simply tell the police that this particular establishment doesn't have a license and is operating, and therefore the activities that they are carrying on with are criminally liable. So I just want to implore, kama una kabaa yako, tafadhali usifungiwe. Ukifungiwa, sasa wewe ni lazima pengine uende kuanza kushunga ng'ombe, na wewe hujui mambo ya kushunga ng'ombe kwa sababu wewe unajua mambo ya kuuza pombe. Kwa hivyo afadhali usifungiwe baa yako. Fuata masharti yale serikali imesema. And therefore, as they are doing their work, the county governments will be vigilant and will be a lot more aggressive in carrying out this responsibility. The ministry, on another score, has provided each and every county with protective gear for its healthcare workers, so that we should not be expecting to hear complaints about shortages of PPEs. However, moving forward, and in accordance with the resolutions made yesterday in the 5th extraordinary session of the National and County Governments Coordinating Summit, counties will be expected to directly acquire PPEs for all their health workers. In this regard, every county has been given financial support from the national government that is specific to COVID-19 over and above the allocations they get on healthcare. The ministry has gone ahead to provide exemptions to county governments from procuring PPEs from KEMSA and been advised on the qualified suppliers for PPEs. Please use these resources for protection of our people. Whenever the ministry acquires on its own via donations, particularly via contributions from local and international sources, we will be distributing those PPEs from these offices and taking them to the most to the counties that require them most. But the counties will assess for themselves and purchase for themselves necessary PPEs for health workers. This decentralization of provision of PPEs should be a good thing and should now ease any county from complaining about lack of PPEs. Turning to our COVID-19 statistics today, 606 people have tested positive from a sample size of 4,888 samples. This now brings us to a total of 18,581 persons in a cumulative total of 284,500 tests. 583 out of those people are Kenyans, while 23 are foreigners. 409 are men or female or male, 197 are female. The youngest case is 4-month-old infant, while the oldest is 85 years old. The distribution in counties: Nairobi heads the list at 448, Kiambu 54, Kajiado 25, Machakos 16, Uasin Gishu 11, Nakuru 11, Kericho 9, Busia 7, Mombasa 7, Garissa now 6, Bomet 3, Nyeri 2, Narok, Nandi, Embu, Lamu 1, and Murang'a has also an additional 1. You'll get the statistics of the detailed distribution of this, but in Nairobi, for example, Embakasi now has become a serious hotspot. If you are living in the Embakasi area, you need to know that Embakasi is a hotspot, and further measures may have to be taken as regards the containment of some of the fast areas that are growing way too fast. So, ladies and gentlemen, without much ado, I just want to once again thank the health workers, because 75 patients have been discharged from the various hospitals, and therefore they have worked so hard recovering some 7,908. And we want to say thank you very much indeed, and to continue the very good work that you are doing. Unfortunately, we have also lost in the last 24 hours some 14 patients from the disease, bringing our fatality to a total of 299, hitting the 300 mark. And my sincere condolences go to the families of those who have been infected. Kwa hivyo nikiongeza tu hapo kidogo, ni kusema tu vile rais alituzungumzia jana tukiwa wa Kenya, na yale masharti ambayo alitoa jana sana sana kuhusu mambo ya kuuza pombe katika restaurants na pali pengine pote pa kula. Kwa hivyo ukiwa wewe unauza nyama choma, uko hapo katika hiyo list. Mtu akitaka kula nyama, si lazima nyama inaenda pamoja na pombe. Hata soda ni sawa, hata maziwa ni sawa. Kwa hivyo watu wasije wakasema ati mimi nauzaga nyama choma, kwa hivyo mimi sio katika zile kanuni ambazo zilitolewa jana. Hapana, anything, hata kama unauza nini ya kula, hata kitu gani, ujue ya kwamba huwezi kuuza pombe. Na kuna wengine ambao ni bars, walikuwa hapo awali kidogo, wameanza kuuza chakula kidogo kidogo, mandazi, ndio sasa wasemekane pia wanauza chakula, ndio sasa watu wanunue pombe. Sasa ujue ya kwamba kama ulikuwa umeanza kuuza mandazi kidogo kidogo ndio upate kuuza pombe, sasa wewe endelea na hiyo mandazi na samosa, lakini pombe usahau. Sasa sijui kama utafunga ama utaendelea na hiyo mandazi. Kwa hivyo jameni, tafadhalini, please, tafadhalini, let's save each other. Niokoe na mimi nikuokoe jameni. Hiyo ndio ile kitu, kwa sababu hata ukiangalia vizuri unajionea wewe mwenyewe vile Kenya hii yetu sasa imekuwa. Watu ni wengi sana, kila siku tunasikia watu wanakufa. Hapo mbeleni tulikuwa nasema hakuna mtu amekufa, mtu mmoja amekufa, wawili wamekufa. Sasa kila siku tunazungumza kuwa watu 10 leo hii watu 14. Kwa hivyo tafadhalini jameni, hii virusi iko nyumbani kwetu sasa. Iko nyumbani yangu na iko nyumbani yako. Kila mtu sasa anajua mtu ambaye ameambukizwa na hii virusi. Kwa hivyo jameni, sisi ni kuwasihi na kusema washeni tuone na macho yetu vile ilivyo, na tuhakikishe ya kwamba tunafanya vile serikali inasema. Sio kurasmishwa, ni wewe mwenyewe ujisikie na jionee vile mambo ilivyo, ndio sasa kwenda mbele tushunge sisi, mimi na kushunga na wewe unishunge. Kuwa ya kwamba leo hii ni watu wengi sana wananiambia sasa Bwana Kagwe, hii mambo ya pombe ni namna gani? Mimi hata sijawahi kusikia story mingi kama zile nimesikia leo kwa sababu ya hii mambo ya pombe. Na mimi nawaambia kila kitu, everything has a silver lining. Everything has a silver lining. Hata kuna watu wengine hujawahi kuwaona hata siku moja. Kila siku ukimwona asubuhi anakuwa na macho nyekundu. Sasa hata pengine tutapata nafasi ya kumuona na macho meupe kidogo. Kwa sababu hiyo mambo atalala vizuri, alale mapema. Bas. Asanteni. Any questions?
Elfas Lagat, Citizen TV. I'd like to draw your attention to a video that has been going viral of someone encouraging people to purchase hydroxychloroquine, alluding to the fact that it has treated about 350 COVID patients with underlying conditions. I think one Stella Emmanuel. So DG would like you to address whether these are substantiated, whether the ministry is actually studying these claims, and is there any truth in it? Thank you.
Anita Nkonge from NTV. Anita Nkonge from NTV. My first question is following up on Elvis Langat's question. There were a couple of tablets that were being imported from India, the medicine that, yeah, exactly. That was being imported from India in May, and I was just wondering how far it is, the shipment, and if it is here, how is it doing with patients? My second question is, there was a bit of a confusion on Sunday about the number of positive cases. Is it 892 or 960? Another question, through your targeted testing of public health facilities, how many people have tested positive? And how many people are being contacted? How many people have been contact traced through contact tracing, just to know in total?
Nancy Okware kutoka KBC. Swali la kwanza ni kuhusu huu mfumo wa kuwa wagonjwa kutibiwa wakiwa pale nyumbani. Je, kufikia sasa hivi kizingatiwa kwamba mgonjwa anasalia pale akiwa peke yake kwa muda mwingi, je, kama wizara kuna mpango wa kuhakikisha kwamba mnawapa nasaha ili wasije wakapatwa na msongo wa mawazo kwa kusalia nyumbani kwa muda mrefu bila kutangamana na watu? Na mwisho kabisa, miongoni mwa waliofariki leo hii, je, kuna wale ambao walifariki wakiwa nyumbani ama katika jamii, na vilevile kuna wale ambao hawakuwa na magonjwa mengine na wamefariki kutokana na virusi vya corona? Asante.
Asante. Yeah, okay. One more then.
I'm Brian Otieno from KTN News. I'd like a status update on how public facilities are faring.
I don't know what that means, Otieno. When you say public facilities are faring and they are not sick, what do you mean?
Are they overwhelmed?
Oh, I see.
Yeah.
Okay. Thank you. Asante sana. Thank you, Otieno. First and foremost, let me say that there are some facilities that are stretched as we speak. For example, the facilities in hospitals, private, especially private and public hospitals, that relates to intensive care. Those ones have been stretched to an extent. There are still some beds available, but for sure, you know, those ones are stretched. It is because of that reason that in the next 2 weeks or so, we shall be opening another facility at Kenyatta University Referral and Training Hospital. We are opening a facility there for an extra increment of 500 beds with some 60 ICU beds in the next 2 weeks or so. It is just to cater for that in case. As for the other county facilities, most county facilities that I have visited, in fact, including last week, were fairly empty. Even those with intensive care units, they were actually empty. Most of the isolation facilities in county institutions are also fairly empty. So you will recall, Otieno, that a while back I was talking about counties not sending people to Nairobi. Quite feasibly then, it is now possible that the reverse may actually be the truth, that some people, if Nairobi gets too overwhelmed before the counties, that it may be possible to do it the other way around. And I'm impressed, never mind the criticism that most counties have been getting regarding their preparedness. I am impressed with the spirit with which I am seeing counties, and I can tell you that the reports, for example, that were in yesterday's papers regarding the preparedness in most counties was actually erroneous. These are just reports, ad hoc reports that come to us at all times because we continue engaging. And sometimes, for example, in the case of Kwale, you know, maybe you visit one hospital in Msambweni and you say Msambweni has got 72, for instance, health isolation beds. But that's not all they have. They have some other isolation beds in Lunga Lunga and other places, because as we advise them, maybe it is not a very good idea to have all the isolation beds in one spot, because some of those areas are large counties, and the more spread they are, sometimes the better. On the issue of home-based care, I am going to push that on to my colleague, Dr. Amoth, and I'm sure he'll do a good job of it. And again, Langat's question on the issue of case management and how we are handling it, on the issue of India, whether we got staff from India or not. Again, I think Dr. Amoth, you can go first on that one.
Oh, okay. Thank you, Waziri. Let me start with a viral video that trended for some hours before it was pulled down by Facebook, Twitter, and YouTube. And in terms of a pandemic, sometimes there's a saying that goes that in times of a pandemic, due to stigma, fear, hopelessness, it is easy to hawk than sell science. As a Ministry of Health, will continue to sell science, will not hawk science. This video was based on an individual who apparently was addressing people somewhere without any scientific basis. The WHO has given very, very clear guidelines based on randomized clinical trials. You can even Google yourself the Cochrane studies, which shows that use of chloroquine in management of COVID-19 disease does not add any value. To the contrary, it actually can pose a risk, especially for those who have coexisting heart conditions, in which case it causes what we call abnormal heart rate rhythms or arrhythmias. And it can also cause damage to the liver with untoward outcome. So there's no basis, there's no scientific basis at all on that video that went viral, and that is why Facebook, Twitter, and YouTube have pulled it down. Let's be guided by science now and forever until we overcome this pandemic. Regarding the question on hydrochloroquine from India, you know hydrochloroquine is a registered drug in Kenyan market and is used for treatment of other conditions including rheumatoid arthritis and systemic lupus erythematosus, which is a condition that affects the skin, the kidneys, and other organs. So the agency of importing chloroquine that time was based on information that was available. But after the randomized clinical trials that were done elsewhere, which were published in peer-reviewed journals, hydrochloroquine azithromycin was adding no value. And therefore, that is why it was even pulled down from the Solidarity trial that even Kenya is a participant. For this, we are going to go with what is proven scientifically. And in Solidarity trial, we are going to use remdesivir. We also pulled down the antiretroviral medicines because they are not adding value. For those who are on home-based care, yes, we will continue to articulate issues regarding home-based care because of the reduction in terms of cost of management of cases for those who qualify. This is a platform that we have used before successfully, and even this we are recording success. And we continue to support those who are on home-based care in totality. It is not just a question of observing your temperature, But as we go as far ahead as giving you psychosocial support together with members of your family. Remember, when you're on home-based care, it's not that you don't have contact with members of your family. It is restricted and supervised contact under the supervision of a qualified healthcare provider. The deaths that were reported today, 14 deaths, 9 of them had pre-existing conditions ranging from diabetes and hypertension combined, or either diabetes or hypertension. 2 of them had cancers. 1 had cancer of the bone called multiple myeloma. 1 had cancer of the esophagus, and the other one had end-stage renal disease or kidney failure. Out of the 14, 4 did not have any coexisting medical condition. And it behoves us, especially those who have coexisting medical conditions, to ensure that we consult with our clinicians and our health care providers to ensure optimum management of our conditions, such that even if you get COVID, then it does not put you at a risk of getting a serious form of the disease. I assure you that if you have a well-controlled diabetes mellitus condition or a well-controlled high blood pressure, the outcome of COVID-19 infection in you may not be different from a person who does not have a coexisting medical condition. So it is imperative that we continue to take our medicines and all the healthcare practices that we get from our healthcare providers to ensure we are in the best state of health. There was a question regarding the figures. Yes, 1 or 2 days ago we had a problem with our figures because of double entry, but which we have since corrected, because you can be tested more than once, and if you don't look at the line list clearly, you'll be able to report that as a separate individual without, if you don't look at the line list critically, to be able to remove the repeat test that confirmed to us that you are now negative of COVID-19 disease and they require to be removed from isolation or treatment. I think Waziri has addressed adequately the issue of the public health facilities. So far, Nairobi, because of established community transmission and because of limited facilities compared to the size of the population, we are a bit under pressure, especially in the private health facilities. And that is why we are thinking of, we are in the process of scaling up another 500 beds in Kenyatta University Teaching Referral Hospital, and with 60 extra beds for ICU care. Thank you, Waziri.
Asante. I think the only other thing that was not answered is the issue of contact tracing. And this is a continuous exercise. Every time we get a positive case, it is mandatory that we must continue tracing the persons who have been in contact with that individual, and as much as possible, try and advise either A, that they can self-quarantine where it is possible, or B, we will provide quarantine facilities where that is not possible. The same applies to what Dr. has alluded to in the matter of self-isolation when you are a positive case. And I think it is important, and we have emphasized this before, but I will continue to do so, that as a matter of fact, the records that we have show that persons who are in home-based care are actually turning negative faster than in hospitals. And so far, I do not believe that we have lost any individual who have been on home-based care. And we pray that this continues to be the case. But and going forward, as the numbers rise, we as families must begin to get interested in what home-based care is all about. In the Ministry of Health website, we are going to publish material for families and advise on how to take care of a loved one if you have got a positive case in your own home. Because you may not have one right now, but there is a likelihood that one is going to be there. And quite frankly, it is a lot easier and a lot more healthier and better that we take care of our own people in our own homes wherever possible. And the other thing perhaps to add, without becoming too scientific about this, I leave that one to Dr. Amoth. I've got a feeling, Dr. Amos, that there were things you told Anita that she didn't quite follow. You know, at least I didn't. When he spoke about those hyphromatosis, I wasn't sure how many of us were following. I didn't, you know, to confess. As for the numbers that he mentioned about, the 892 and the 960, I think the clarification is really simple. And that is to say that the report of 960 included some samples that had been repeated. Because sometimes an individual comes and turns out positive, there is doubt about the test, or some other person had been tested, and you have seen these cases. The truth is, sometimes a mistake can happen, and the best option for us is to own up and say we give you a figure of 960, however we have since learned that the number, so many of them, were actually a second testing, and therefore the sample that we had given you is the wrong one. I think it's better to do that and own up to a mistake than simply to convince ourselves that the figures that we gave are the correct ones. This is not the only time that mistake is going to happen. We are human beings. It is likely that something like that can occur. And this is not the only place where it's occurring. When it does occur, what we do is that we try as much as possible to ensure that it doesn't happen again. We take measures to protect and secure the testing so that the results that Kenyans get are the correct ones. Thank you all very much indeed. You know, in this cold weather,
When